Welcome to Revolutionizing Care, the podcast that dives into the technologies and trends redefining the future of medicine. I'm Jeff.
And I'm Mark. Today, we're exploring one of the most profound transformations in healthcare, genomics, and specifically how it's powering a shift from reactive treatment to proactive, more personalized care.
And that's absolutely right, Mark. And so whether you're a health system leader, a clinician, innovator, you probably heard about genomics. But what's often missed is just how far this field has advanced and how critical it is to have the right expertise guiding you through it.
You know, I've been amazed, Jeff, as I've just recently gone back and looked at my results, even from just ancestry years ago, and how with that information, I can do something relatively easy with ChatGPT or, Google Gemini and start to get insights. And I know it's probably not entirely accurate, but it's really interesting how it's allowing me to start thinking about personalized medicine. And, if I were to actually do the real genomic testing, I know that there are tailored treatment plans that would, be based on my unique genetic makeup, whether it's pharmaceuticals or whether it's supplements.
Yeah, I wish I would have done the ancestry thing. I never did that, but I think I can get it now and more. So what we're talking about here is understanding how patients metabolize drugs. This is really the first big capability that I'm seeing. Mark and I, we've both set in with some people that have had these tests done. It's pretty amazing. And so understanding how your body metabolizes a drug can then inform which therapies they're most likely to respond to, and even what diseases they might be predisposed to. And it's all from one test.
To me, it's really a game changer, right? It's changing how folks are treating cancer or mental health or cardiovascular disease, and genomics can start helping clinicians and other healthcare advisors start providing their advice with precision.
Yep. But precision medicine only works when you know how to interpret those results. So more importantly, how do you act on them within your existing clinical workflows? So that kind of leads us to our next capability. Let's talk about preventative care based on risk genomics. So we all know genomics is also making prevention smarter, but with risk analysis on top of that, based on DNA markers, we can now identify individuals at higher risk for chronic diseases even before the symptoms begin.
You're exactly right. And it's not just, genetics for family history, right? The ancestry example that I gave earlier. It's getting into the specific variants that might be tied to different conditions like, type 2 diabetes or Alzheimer's is something that's been in my family, and certain cancers, right? It just goes on. And getting these genetic tests allow the care teams to intervene much earlier and much more effectively.
Yeah, that's the promise of a true proactive healthcare, right? But making it real requires more than just a lab report. So it requires integrating your genomic risk data into primary care, into life decision changes, coaching, and care planning.
And from my perspective, it almost becomes a strategic decision, right? You have to tackle it with planning and strategy. And without it, the risk scores sit in a folder and no one's acting on it. And so instead, you've got to have the right team or the right advisors that are providing the right consultation to help you drive your action plan.
Yep. And making sure that team has the right tools around them to be able to get access to it, see it, and really help the patients be as successful as they can.
That's right. And so let's pivot, Jeff, a little bit more, less on the pharma side of things and start talking about just Nutrigenomics.
Yeah.
And using that same genetic information to guide, nutrition, supplements, lifestyle changes. Jeff, you've kind of looked into that a little bit more. What are your thoughts?
Yeah. So what we're seeing, we're seeing it especially in functional medicine, wellness clinics, integrative care type of practices, and this type of genetic testing can reveal how a patient processes fats or carbs, detoxification, how does your body absorb nutrients. I think it's something that more of the performance minded folks, so think athletes, people that are training, they've probably been in this camp for a while, but it makes a ton of sense. Even if you're not trying to go run the Boston Marathon, if you know that my body doesn't react well when I eat this, that's a lot of great information that could be an easy life change.
You're exactly right. And some patients have complex, chronic type conditions, and it's clearly a game changer for those. But I'll talk a little bit about my wife, right? And as she's aged, it's just a reality that, and it's true for men and women both, that you get to a point where your body has changed, and so you don't have a complex or chronic condition. You're just aging, and helping to fine tune your diet and have supplements that actually work according to your specific biology, that to me is, again, what's really interesting. It's not just telling me a specific supplement that I need, but it also can help determine which versions of that specific supplement might work better with my DNA makeup.
Yeah. And so this is where it's going to raise the bar for providers. The consumers are getting more informed, hopefully through this show and other ways. And now the providers are sitting there, and without the right tools and training and having systems and AI agents that can assist with the genomic recommendations, this can all feel like a foreign language to the provider and the patient.
Some people call it clinical decision support, right? It's a lot of words, but having some sort of a consultant who can map the insights into a real plan for you, that to me is one of the keys.
I see medical professionals today that may be classically trained in one discipline of, maybe they're medical doctors, right? And their primary care physician. Heck, my primary care physician, about 8 months ago, I started seeing all kinds of things on the wall around wellness, around peptides, things that 2 years ago I probably would have seen in the med spa. And I'm starting to see these things show up.
One thing that I've heard about, Jeff, that I don't know much about is genetics and screening programs around population health. Do you know much about that?
Well, I know it's starting to happen some. It's a hot button topic. Let's just say that, Mark, because there's a little bit of fear of Big Brother. Here's what we're talking about, folks. If you zoom out at a system level, genomics is starting to shape pop health through screening initiatives.
The health systems at a macro view, right? Or the payers, insurance companies, that they're beginning to try to leverage genomic screening across thousands of patients to identify, the big areas of risk. And I've heard that they have to do that with anonymized data, right? So they have the genetic results, but they don't tie it back to the individual. But these huge health systems and insurance companies are trying to identify the biggest areas of risk and determine how to detect it earlier and then kind of be more proactive in the care. Is that what population health means?
Well, this is a new way to approach population health. And so this is where we've got trust issues that have to get solved, privacy, trust. But imagine, for example, you're able now to identify patients with a BRCA mutation at a genomic level, or hereditary heart condition. I actually am going to be a big fan of that if it allows that health system or even the payer to intervene earlier with me, uh, for my well-being. It's just there's some fear that it could be used inappropriately to screen you out of certain insurance programs. Oh, we don't need Jeff. He's going to have a heart attack in 10 years. You know?
Exactly.
Yeah.
Exactly. Exactly. So, to me, it feels like, for one, I don't think any of the legacy EMRs have, genetic type capabilities other than, plop a PDF in there, which really is not easy to then act on.
Yeah.
But for those few that are out there that are bleeding edge, AI enabled EMRs that have already integrated genetics, I think that's where it's going. But you still have to build patient engagement strategies, right? You have to gain the patient's trust. You have to ensure that it's an ethical use of that data. Like you said, you can't be, canceling someone's insurance or denying their insurance because they have a gene that indicates in 20 years they're going to have Alzheimer's, right? So it's not just the science. To me, it feels like systems design. Coming from an industrial engineer, everything goes back to systems design, right?
Yep. Yep. So maybe we pivot a little bit and talk about how AI meets genomics, because I think that can help alleviate some of these concerns. And we'll call it the intelligence layer. AI is a big lift when you can marry the AI to certified, high, governance controlled bodies of knowledge. New England Journal of Medicine, pharma case studies, peer reviewed, large populations. When you can have your AI models that are trained against that level of information, not Twitter posts and uh, the Facebook doctor, then you can start trusting AI to give you those kind of interpretations, even assist you with uh, uh, goals, treatment plans, things like that with your patients, all in this new longevity, wellness driven by genomics. So AI models are helping researchers and clinicians find patterns, in vast data sets, and that's where the big anonymized data sets. That's great because it's not targeting any one individual. But anyhow, they're using that kind of information, and they're able to, spot patterns that humans would just never spot, right? It's advancing the science tremendously.
And what I've heard is, well, not only does it give you access to more of the information, but it's making faster discovery of the biomarkers, and it makes us smarter on risk prediction, and more precise matching of patients to treatments. Lots of
Yeah.
applications.
Yeah. And byproduct, it also means we're going to need infrastructure that can handle terabytes of genomic data. Here's a fun fact. If you get your whole genome sequenced and you get the the industry standard file format, that is some file format is called VCF, not to be confused with the VCF that's also the contact card out of your Microsoft Outlook. Yeah. But yeah, a one person's data file is between 5 and 10 gig. So
Yeah.
we're going to need infrastructure. We're going to
Yeah.
have to be able to handle
Yeah.
storage of that because it's just too valuable.
Well,
The information's too good
yeah.
to improve everyone's lives.
It all comes down to, again, you're going to have the right partner. You're going to have someone who understands both genomics and AI, and make sure that they can combine those two to help make sure that you unlock, the exponential value that you can have with true, instead of, again, reactive medicine, proactive wellness.
Yep. Yep. So let's take a step back. I want to pull in a word you used earlier, strategy. So sequencing a genome is just the beginning, right? The revolution comes from what we do with that information. And that's where some of the strategy planning comes in.
I think that's right. I think you're saying, genomics alone isn't going to transform your health or the health system, but, genomics tied to the right strategy, whether it's patient engagement, clinical protocols, smart technical infrastructure, AI, right? Combining all those things absolutely will.
Yeah, genomics is not the hammer, but if we put the right guidance, governance strategy around it, oh man, the sky's the limit. So, and then that's where expert guidance is going to come in and make all the difference, because a good genomics consultant doesn't just help you run a test; they're going to help you build a roadmap. They're going to navigate those regulatory hurdles and align your people.
That's exactly right. And it, from my perspective, when you start to integrate it all into a strategy, that's when you start to talk about true revolution in healthcare.
Yeah. So if your organization is exploring genomics or struggling to scale it, now's the time to get some expert support. Visit us at www.mlhealth.ai to learn how we can help turn genomic insight into measurable outcomes.
Thanks so much for tuning in to Revolutionizing Care. Be sure to subscribe and share the episode, and join us next time as we explore more of the technology shaping tomorrow's healthcare. See you next time.
Yeah. Hey, say that whole thing again, because you said thanks for tuning in, and then it went blank on my side for about 5 seconds.
Oh, thanks for tuning in to Revolutionizing Care. Be sure to subscribe, share this episode with your friends, and be sure to join us next time as we explore more of the technology shaping tomorrow's healthcare.